Hi, I'm Dr. Buzz Korth, and I want to talk to you a little bit today about Push Patch. What is Push Patch? Well, Push Patch is a company that we developed that uses iontophoresis to deliver molecules that are very beneficial to the body. So, what is iontophoresis? Well, here's an iontophoresis patch. Unlike iontophoresis patches of the past, that the first ones I ever used in my practice were like a TENS unit with wires going to it. These units here have their own microprocessor. So all you do is you simply apply it to the area and pull this out, which activates the battery. And then what happens is it uses electrical energy to push the molecules directly into the bloodstream. So think of it as an IV without a needle. Now, obviously, you can't iontophoresis everything, and we really don't want to. What we focused on with Push Patch are molecules that have a small enough size to be able to be pushed with iontophoresis, and also molecules that aren't really available, bioavailable orally. So if you can take something orally, or if it has a long half-life, then injections are fine. But the molecules we're dealing with are NAD+, glutathione, and BPC 157. Why we choose those molecules? Well, number one, those are molecules that can benefit a large percentage of your populations for different type of conditions. And number two, they have very short half-lives. NAD half-life is about an hour. BPC 157 half-life is only 30 minutes. And glutathione, depending on what research you read, is between 10 and 90 minutes. So what's a half-life? Well, half-life is if you take a medication, for example, we'll take BPC 157, and a standard injectable dose of that is 300 micrograms. Well, the half-life is about 30 minutes. So when you do a BPC 157 injection, and you do 300 micrograms, 30 minutes later, you're only getting the dose effect of 150 milligrams. And then 30 minutes after that, you're getting the dose effect of 75 milligrams. And you go down, and there's typically 5 half-lives, and you don't get a dose effect. So you can see if you're using BPC 157, we'll say for inflammation or pain in a joint, really to get the time under dose, you'd have to inject that joint 4 times during the day, which is inconvenient. And BPC at 157 also, although it is orally bioavailable, you lose about half the strength. So, and you also lose some of the benefit. There is research that shows that, the closer you can put the BPC 157 to the site of injury, the better it's going to help to heal. So although there is a systemic effect, you also do want to put it as close to the site of injury as possible. And obviously with the patch, if you have elbow pain, neck pain, wherever, you can put the medication exactly where you want it to be. And the time under dose will be greater because these patches are 12 or 14-hour patches. We have both. You're getting dosed for the full 12 or 14 hours instead of, that short 30-minute half-life. So that's why these patches are so great. The same thing with NAD and glutathione. That, as we had mentioned, the short half-life of those. So typically what people are doing, NAD is not orally bioavailable. And people can take, there's a medication or a molecule, I should say, called NMN, which increases intracellular NAD, but it doesn't increase extracellular NAD, which is very important. So really the only way to increase that extracellular NAD, which a lot of the benefit comes from, is either you have to either take an IV, but it has such a strong effect on the mitochondria that the IV of NAD is typically a 3 to 4 hour IV. And who has time to sit on an IV for 3 or 4 hours? And if you try to go faster, you don't feel good. But with the patch, you simply put the patch on, go throughout your day, and you're getting dosed NAD for 12 to 14 hours through the day. So you just can't beat the method of delivery. It's very easy, very safe. And the same thing with glutathione, that short half-life, 10 to 90 minutes. Everyone needs glutathione, so why not wear the patch? You're getting dosed all day long. So that's what Push Patch is all about. We're really excited about it. The results have simply been incredible. Definitely check us out.